So I think most of you know I'm Gary Shiganaka from NOAA. I am going to moderate the Human Dimensions panel. Those of you who were here yesterday know that I've noted an element of human dimensions in the history of oil spills, and certainly there is a strong human dimensions element in oil spill response. And so we're really fortunate to have a very robust and varied panel to dive into human dimensions. Basically, we will be covering broad subject matters like sociological effects of disasters, community participation in spill response and planning, and also seafood safety and human health impacts during oil spills and oil spill response. So I would like to just briefly introduce the panel members so you know who you're looking at up here. I made them come up and sit in front for the whole session. To my immediate right is Dwayne Gill. He's a professor and head of the sociology department at Oklahoma State University. To his right, LaDon Swan. He's the director of the Mississippi-Alabama Sea Grant Consortium and Auburn University Marine Program. Tim Robertson, who's the general manager for NUCA Research and Planning Group in Seldovia, Alaska. Bob Dickey, who late was with US FDA, but now is director of the University of Texas Marine Science Institute and chair of the Department of Marine Sciences. And then finally, we have Richard Kwok, who is an epidemiologist with the National Institute of Environmental Health Sciences with the NIH, National Institutes of Health. And he's also the lead associate investigator for the Gulf long-term follow-up study. So we'll be hearing about that today. So without further ado, I would like to just dive right into brief. We're going to do 10-minute presentations by each panel member that sort of give an indication to you what their field of specialty is. So we're going to start off with Dwayne Gill from Oklahoma State.
Thank you, Gary. So first of all, I'd like to thank Nancy for hosting us, and I'd also like to thank all the volunteer students who've worked real hard to make this thing happen. I'm here to speak a little bit about the human dimensions of oil spills, and before I do so, I'd like to mention two of my colleagues who've been very instrumental in the work that I'm about to describe. Steve Piku, he and I started working on the Exxon Valdez oil spill back in 1989. Liesl Ritchie joined us in 2000, and then the three of us have also worked on the Deepwater horizon. Yesterday, someone made the comment that chemistry is easy, biology is difficult. Sociology is complex and complicated. You know, our subject matter is constantly evolving, especially during crises. So my experience with the oil spills, again, started with the Exxon Valdez, 1989. We just completed our studies in 2013, so 24 years of research on the human impacts of this oil spill, including the litigation impacts. Lisa and I did some work on the Selandang Ayu shipwreck and oil spill and the Aleutians. We also did some work on the Costco Busan in San Francisco in 2007. And then after we thought all this oil spill business was over, we have the Deepwater horizon, and we initiated a study in 2010 focusing upon coastal Alabama, primarily South Mobile County and later Baldwin County. Someone also made the statement, several people made the statement yesterday that no oil spill is the same. Once you've seen one oil spill, you've seen one oil spill. But there is some consistency in the impacts that occur in human communities. We have looked at two broad levels of human impacts, primarily sociocultural and psychosocial. So the sociocultural are things that happen at the larger community level, changes in community structures, group dynamics, so on and so forth. I'm not going to speak much about that today. What I'm going to focus on is the psychosocial or the community mental health issues that arise out of oil spills, particularly as they affect communities. This is something which Admiral Allen referred to as behavioral health, and it is something which is very significant. So one of the things that we did in looking at some of the impacts of the mental health situation is we had some consistent measures that we used both in the Exxon Valdez case and in the Deepwater Horizon case. In Exxon Valdez, our primary community that we studied was Cordova, Alaska. If you know anything about Cordova, it's primarily a commercial fishing community. It has a significant presence of Alaska natives, so you have kind of a mixture of subsistence culture and commercial fishing. And as Steve and I learned more about this community in the late 1989, 1990, we developed a concept of the renewable resource community. And this is a community whose primary economic and cultural and social structure is based upon renewable natural resources, in this case, fish, other subsistence resources. So what we found is that these resources were either damaged or threatened by the spill and cleanup activities, and so you had a lot of disruption in the kinds of activities, both cultural and economic, that took place. Our primary measure of mental health, of psychosocial stress, is something called the impact of event scale. The impact of event scale has been around for several years. We used it back in the early 80s with a train derailment and toxic spill in Louisiana. It was developed several years before that. But it's basically a standardized measure of psychosocial stress. And so when we first studied Cordova, we used this measure. We found that indeed there were some high levels of psychosocial stress as indicated by this measure. Several years later, when the Deepwater Horizon occurred, we used the same metric. So we have an ability to compare the psychosocial stress in Cordova after the Exxon Valdez with the psychosocial stress in South Mobile County, first in 2010, and again later we expanded that to Baldwin County. So we have some fairly consistent measures across time. The other important thing to note is that we were able to kind of replicate in terms of the time frame of collecting data from Exxon Valdez to Deepwater Horizon. So we were able to get into the field in Cordova in August, about 5 months after the Exxon Valdez ran aground. We were able to deploy a survey in South Mobile County, again about 5 months after the Deepwater Horizon. So we have some fairly consistent time frames. We followed that up in 1990 in Cordova, in 2011 in South Mobile County and Baldwin County. So one of the things we discovered, our data indicated from Cordova, was that there were high levels of psychosocial stress. And the impact of event scale, you're able to kind of divide up and make some clinical analysis of people who have really severe levels of stress versus moderate, mild, and no stress. So we found in 1989 in Cordova, about 15% of our sample, and assuming it's a representative sample, about 15% of the population of Cordova were in the severe mental health or severe category of the IES. Significant differences. It was higher among commercial fishermen and Alaska natives, those who are closely tied to the damaged resources. And the mental health situation in rural communities like Cordova is very tenuous. First of all, there's stigma about seeking out mental health services. In Cordova, you go to the hospital, you take a left for medical services, you take a right for mental health services. You got a town of about 2,500 people, and everybody knows whether you took a left or whether you took a right. So people were not seeking out the mental health professionals that they probably really needed. So in 1995, we received funding from the RCAC, basically to develop an alternative mental health program. And one of the things that came out of that program was a peer listener program that Steve Picu did a lot of the lead on. It's very interesting in that it had an important impact. We saw some decreased levels of people in the severe category of the IES after we implemented this program. And interestingly enough, Steve lives in Orange Beach, Alabama. So he was in the community in an area that was affected by the Deepwater Horizon. And one of the things he started doing immediately after the Deepwater Horizon was going to communities throughout the northern Gulf of Mexico and doing peer listening. Now, this is a result of this is not 2010, this is accumulated over the last 3 or 4 years. But he actually went out and was trying to get ahead of the curve of the mental health issues. I think it's significant to note that that didn't happen in Exxon Valdez. It did happen in Deepwater Horizon. But when you do the comparisons, 16% of the sample in South Mobile County were in the severe category in 2010. It increased to 18% in 2011. So even though we were out ahead of the game with mental health, we were not ahead of the game in terms of the impacts or the amount of the percentage of people who were in the severe category. What was going on? I can only speculate some of what was going on. I think part of it has to do with the media. The media plays a role. You didn't have the 24/7 coverage of the Exxon Valdez like you did with the Deepwater Horizon. You didn't have the social media, all the other kinds of aspects. What I observed in the Deepwater Horizon was kind of the media circus. So you have all this media attention, but what happens when the circus leaves town and moves on to the next place? Fukushima happened. That was the big next media circus. There's been all kinds of other events that capture the media's attention. We do know some of the things that underlie psychosocial stress. First of all, as I mentioned earlier, your relationship to the damaged or threatened resources. So the closer you are to these resources, the more likely you are to experience psychosocial stress. If you experience resource loss, economic, subsistence resources, this is another driver of psychosocial stress. In particular, if you look at the Exxon Valdez case, the loss of herring, whether it is a direct or indirect or no effect from the Exxon Valdez, the herring fishery collapsed. It has not been in existence now for 20 years. That was 1/3 of the community's income. That's going to create stress. Recreancy is another issue or another factor that predicts high levels of psychosocial stress. When you talk about recreancy, you're primarily talking about assigning blame. Someone didn't do what they were supposed to do. Someone failed to public trust. So these feelings or perceptions of blame and recreancy, a loss of trust, fuel increased levels of psychosocial stress. Risk perceptions is another factor that influences stress. If you are concerned about your family's health, if you're concerned about seafood safety, if you're concerned about other risks that have been raised to a high level because of the incident, again, you're more likely to experience this stress. Another big driver of the stress, particularly in the Exxon Valdez case, was the litigation and the unresolved litigation that seemed to linger on and on and on. All this creates an air of uncertainty, and if you have high levels of uncertainty, you're going to have high levels of psychosocial stress. So we know some of these factors that contribute to these high levels. I think there's a need to increase community resilience, not just to oil spills or disasters, but overall. So when we talk about community resilience, particularly in terms of mental health issues, primarily we're talking about resilience as the ability to absorb and recover from shocks to the system or to a particular community. One of the things that has been going on, particularly since 9/11, has been a federal initiative to enhance community resilience. And when we're trying to figure out how to enhance community resilience, again, paying attention to mental health issues is part of building resilience. So we have kind of a federal initiative for all communities throughout the U.S., whether you're exposed to oil or potential oil spills or not, to increase one's resilience. So Dr. PQ now has the Coastal Resource and Resilience Center out of the University of South Alabama. Again, the peer listener training manual and other activities that taking place in this center is something which can be used to improve community resilience throughout the entire nation. Now, as we look at some new concerns that are facing communities as they try to improve their resilience, enhance their resilience, some of the things that were mentioned this morning come into play. For example, the Bakken crude, highly volatile, so you got rail transportation as a potential source of problems. Pipelines is another source of problems. And some of the issues have to deal with an aging infrastructure. So as you're trying to improve community resilience, not only are you working on social and human and psychosocial components, but you're also looking at the built environment. How can we improve the aging infrastructure that's increasingly carrying these toxic chemicals and so forth? You got the Bakken crude, highly volatile. You have bitumen, which is highly toxic. We don't really have a good idea of how dispersants work on it. We have a lot of development in the Canadian tar sands area. Where is that shipping taking place? Again, rail, pipelines. Do we have the capacity to deal with this? And I think one of the things that we need to consider is that a lot of rural communities are really not up to the ability to respond to these increasing risks from oil pipelines and rail car accidents. So when we're trying to lift up community resilience, improve the mental health capability, we need to take into account what the lack of capacity in a lot of rural communities to deal with this. So when we're talking about funding, there's lots of funding needs to deal with this at the rural community level. So how do you do this? That's a good question. I think really one of the things we need to do is work at the grassroots level, try to re-energize our democracy. And as someone mentioned yesterday, those bearing the risk and the cost of transport of oil should have a place at the table when it comes to discussing how we deal with these kinds of incidents, whether it's marine or inland. The people who are bearing the cost, bearing the risk, should have a place at the table. How we go about doing that, again, is a political and policy issue that hopefully the next panel will be able to give us some insight. Thank you.